What is cubital tunnel syndrome, or ulnar neuritis, or ulnar nerve compression at the elbow, and what do you do about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. The ulnar nerve is a nerve that runs right along the inside of your elbow. This is what you hit on basically a hard object that is that lightning pain and numbness and tingling in your fourth and fifth fingers that you get, and you call it, you hit your funny bone. This is that bony prominence. That ulnar nerve runs right behind it. You think it's the bone that causes the issue, but you actually injure your ulnar nerve. Not injure it, but you temporarily bruise it. It goes away pretty quickly. But you can actually have chronic irritation or chronic compression of that nerve. There's different ligaments that run in this area. It can be stress from repetitive throwing, but you can get irritation or compression of that nerve. Irritation or inflammation of that nerve, ulnar neuritis, the itis being inflammation of the ulnar nerve, or ulnar nerve compression. The other nerve or term is cubital tunnel. That sort of area where it runs behind that bone is called the cubital tunnel, just like the carpal tunnel for the median nerve in the wrist. So if you have ulnar nerve compression or ulnar neuritis at the elbow or cubital tunnel syndrome, what kind of symptoms do you have? Well, you may have some elbow pain or forearm pain, but typically this actually manifests down in the hand and fingers with numbness and tingling on the fourth and fifth fingers, basically on the palm side of, not so much the back of the fingers, but on the palm side of the fourth and fifth fingers. You may even have weakness with grip and various things related to that. But typically the first things you notice, numbness, tingling, maybe even a little bit of the loss of sensation. You may have some vague forearm pain as well. Now, you can try things like anti-inflammatory medications. There's even a brace to sort of keep your elbow straight while you sleep, because a lot of people, with keeping your elbow bent for long periods of time, that actually irritates that ulnar nerve. So those are non-surgical treatment options. But one of the things you can do sometimes to figure out if this is the problem, there are nerve conduction studies that you can get that show you that that nerve is compressed at the elbow. And sometimes, if that's what you find to be the case, there are surgeries to basically relieve pressure on that nerve. The surgeon can go in and open up and basically release any constricting structures there. Sometimes they'll even transpose that nerve if that nerve is sort of sliding in front of that medial epicondyle, what we call ulnar nerve subluxation. So they can do what's called an ulnar nerve transposition, or basically move the nerve to just in front of that bone and hold it in place either with muscle or just soft tissue, and that can be fairly effective. But it may just be that you need that area sort of decompressed. Hand surgeons a lot of times do these. Sometimes shoulder and elbow or sports medicine surgeons. My experience, more hand surgeons do that surgery than do sports medicine doctors or shoulder and elbow surgeons. But a lot of times that's worth asking if you need somebody and need a surgeon that really does a lot of those surgeries. Now, are you dealing with ulnar neuritis or ulnar nerve compression or cubital tunnel syndrome? I'd love to hear your experience. What kind of symptoms are you having? How did it start? And what kinds of treatments did it take to get better? I'd love to hear what you have to say, hear your experience, and I know that viewers dealing with the same problem would love to hear what you have to say as well. So below this video, share your experience, how you developed it, what kind of treatment you had, how you ultimately got better, so we can all learn from it. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my video channel. Click the subscribe button in the upper right corner of this page. I record a few of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. If you know somebody dealing with ulnar nerve problems at the elbow, please share this video with them. Hopefully it can help them get over it as well. Thank you so much for watching, and I look forward to seeing you right here next time.